Hello, everybody. It's Rita at Gold Medical Jobs, and coming to you on Facebook. It's the 23rd. Happy autumn. In Southern California, it hasn't changed much. I don't know about where you're at. It's still pretty warm. And last week, we talked quite a bit about salaries. Um, if you're going into a profession, that should be something you know about. And uh, have some concern about if you need to make a living. Most of us do. And so we talked about that quite a bit. Check out a blog I wrote. I'm doing a blog every so often, and I usually expand on some of the topics. So this last blog um, is about salaries. So if that interests you, go right ahead. Check out my blog, Gold Medical Jobs. And what else is new? I think since Gold Medical Jobs is all about employment opportunities and employment needs in the medical community, in the healthcare community, um, and about available healthcare workers, primarily nurses, but many other professions, physical therapy, radiology technology, CAT scan, um, ultrasound techs, etc. Um, I think it's always a good idea to talk about employment, seeking employment, and um, and then seeking employees. So the employer needs to know exactly what they want. It's a great idea to have a job description. If it's a new concern, maybe a new clinic or a growing surgical center or a maybe in addition to a bigger hospital, maybe they've added an annex and so forth. So it could be a job description that's in process. So don't be concerned about that. Um, my suggestion is to know what you're looking for um, as an employer and as an employee. So if you are, for example, let's use just sort of a basic example. If you are a um, well, let's talk about a we'll talk about something that I know a lot about. Is usually a hospital physician. So let's just say that you're a med-surg nurse. You have lots of experience in the medical surgical units, and you have a little bit of experience in um, oncology. Okay, so primarily for the last 5.5 years, you've been working primarily medical surgical as a medical surgical RN, and then you have 2 years ago spent at least 9 months maybe on an oncology. Primarily, they floated you to an oncology unit. So those are your areas of expertise. When you say move out of town or maybe apply for a travel position or whatever. Know what you're seeking. Say, I really want to break into that oncology. Maybe your thought is, I really want to break into oncology on a more serious basis. I want to get chemo certified. I want to work with my oncology patients from the beginning to the end, from the inpatient to the outpatient, and that's your goal. Or, I've had my taste of oncology and I didn't feel like it was a good match for me. So I want to focus more on my medical surgical patients, maybe pursue becoming an expert in diabetic teaching, and so forth. So go into your interview knowing what you want and letting your interviewer know what kind of learner you are. I'm a very hands-on learner. I'm a very visual learner. Um, I did best when I was able to um, follow someone and watch them, and a lot of times back in the day, because I became a nurse in the 70s, the 1970s, yeah, it's a long time ago, um, that we that we our process. Sorry, sorry, I couldn't turn that off quick enough. That we part of our process generally in a clinical area in a hospital was to uh, watch once. Okay, so if there was a procedure, maybe putting in a catheter or whatever, you watched your mentor or your whoever you were following once, maybe your nursing, the person in charge, you or whoever you were paired with that had the knowledge. You watched them once, then they watched you once, and then you were evaluated solo. So it's one, two, three. Okay, three. Anyway, that was an old process that worked pretty well. Some people need a more literary understanding. They need to review things, read the chapters and so forth. So whatever kind of, and of course, I did a lot of interviewing in my career because I employed a lot of nurses, and then I worked for other employers that had me as a supervisor. So my responsibility was to employ, interview, hire, fire, all of that. So it's very interesting that the average, particularly a very confident young person, will say, I will ask them what kind of learner they are. And the immediate response is, I'm a fast learner. But that's great. That's great. I would never have listed myself as a fast learner. I would say moderate, because I just really want to understand pretty deeply. And so that was my need. But it's more than speed. It's more than, well, it really takes me a long time to learn something, but once I've learned it, I have it for life, like riding a bike. That's not necessarily bad. That's just knowing yourself. But speed is not the only part of the learning process. It's how you best learn. So is it word of mouth? Is it visual? Is it hearing? Is it watching? What works best for you. So I think that's an important thing to know about oneself. And I also think it's important going into an interview, whether you are the interviewer or the interviewee, what you want. You may have a salary in mind, and that's absolutely fine. Know your area. I mean, know your area if you're in the Midwest or you're in the Southeast or the Southwest or the West Coast, wherever you are. Know what the range is. So don't be hoping for $100,000 to start plus comp, plus all like 3 weeks of vacation and et cetera, et cetera. Don't expect that if you're applying for a job where that is out of the realm of possibility. So know your area, do some homework, and have an idea. And know that too, that what you bring to the table has some value, and there may be some wiggle room for that. Your 5.5 years of experience, or your, dual specialties. Maybe you're bilingual. That may be an important factor depending on what the position is. And yeah, and I think to the employers, I would say too, go into your interview, or whoever you deem to be the, initial interviewer, let them have as much information as possible about what you're looking for. Are you looking for somebody temporarily, that you're having a growth surge right now and you've got 2 people on leave, and so it looks like the next 3 to 6 months we're going to need additional staff? Or we're growing and we're going to add beds or clinic rooms to the annex, and we are looking for long-term employees. Generally, when I was in my own business of hiring nurses, I was seeking long-term employment. To me, your job that you spend 40 plus hours a week possibly at is your home away from home, and you wouldn't want to bring somebody into the family for just a few months. That was my choice and my need for my company. But I think it's important for the employer to know what they are really looking for. to have a real good idea, and to that the interviewer, whether it's the boss or somebody that they delegate, that everybody is on the same page and knows what they're looking for. Another thing is, I often did a lot of my own interviewing. It was part of my role, but I wasn't always able to do it because I might have had, I might have been needed somewhere else in the community, visiting a client or a hospital or whatever. And so I would have my office manager or a staffing person conduct the interview, and they would have tools. They would have, so usually had some brief exams, just what do we call it, critical thinking, basic exams. It depended on what we were looking for. If we were looking for nurses or office staff or whatever, you still want an idea of who you've got. And if your basic exams were critical thinking or scenarios, it just could be like reading a story or basic uncomplicated mathematics. You wanted to know if that person that you were interviewing was capable of that type of thinking. So we just have these little exams. They might be 10, 15, 20 questions, and they were not necessarily related to the job at hand, but how they thought about if they read an article and what they absorbed, and did they hone in on the primary point of that. So what kind of thinker they were would help us. And if they failed miserably, that would be a big concern. They may or may not make it to a second interview because other things about them were beneficial, and maybe not everybody's a test taker, So a lot to think about when you're interviewing and when you're being interviewed. Most importantly, what do you want as an employee and or as an employer? Have an idea of what you want. A lot of times I would go into interview someone, and I had already been in business for a while and employed for similar or the same position. We were growing, so we went from 2 employees to 15 and 16 employees to hundreds of employees. So at that point, you've developed a picture, and I would, in my mind, and I would, semi-consciously know that, I really liked this one employee that had been with the company for a long time. I really appreciated her organizational skills. Or I really liked this employee because no matter how tough things were, or how bad the weather was, or how, disgruntled the people they were dealing with were, or whatever, that this person always, their cup was always half full. They always had a smile on their face. Their graciousness penetrated through all of the difficulties. And I thought that's such a great quality to have, a graciousness and a positivity that carried through day after day, hour after hour, for the most part. And so in my mind, as I was interviewing, if somebody never smiled at all, uh-oh. I had a little hiccup in my internet there. But anyway, if I was interviewing somebody and they just didn't look happy at all, if they didn't seem attentive, if they didn't, what's going on with my internet? Hello, people. Hello. It's still Monday, the 23rd of September. Okay, we're talking about interviewing and the importance of knowing what you want when you're seeking a job, and knowing what you want when you're the employer trying to fill a position. So that's step one. I don't know what's going on with my computer. I'm going to sign off. It's just Monday. We'll check back in with you on Wednesday and again on Friday. I mentioned check out our blog because usually my blogs will follow the trend of the conversation and the things that we're focusing on. Last week it was primarily salaries for RNs, And this week, I think we're going to focus on interviewing. I think it's a good idea. If you have any other ideas, please let me know on Facebook at Gold Medical Jobs. I seem to be going in and out. I am very sorry about that. A technical whiz, I am not. Anyway, see you again on Wednesday. Take care, everybody. Bye.